What if I told you that one of the most common reasons people feel exhausted, foggy, and weaker than usual is because they're getting older? What if the real problem was something happening quietly, deeply inside your blood? Something that doesn't make a lot of noise, but slowly drains your energy over time. I'm Dr. John, board certified in internal medicine as well as geriatric medicine, and this channel is here to promote your health and your well-being. Think your health. And here's the part that's both important and a little scary. Iron deficiency is the most common nutritional deficiency worldwide. It affects people of all ages, men, women, teenagers, children, and older adults. It doesn't care if you're fit, healthy, or doing everything right. It can sneak up quietly, making you feel like you're just off until one day it's undeniable. Why does this matter so much? Iron plays a crucial role in how your body works. Low iron doesn't just make you tired. It can affect your ability to think clearly, your heart's ability to work efficiently, your muscles' ability to get oxygen, and even your mood. And most importantly, iron deficiency is rarely random. There's almost always a reason it's happening. If you catch it early and treat the cause, you can absolutely turn things around. Iron is like the engine that keeps your red cells working. Your red cells carry hemoglobin, the protein that picks up oxygen in your lungs and delivers it to every single cell in your body. When you don't have enough iron, your body can't build enough healthy red cells. Organs and tissues are essentially running low on power. That's why iron deficiency anemia shows up as fatigue that doesn't improve with rest, trouble concentrating, dizziness or feeling faint, and shortness of breath, especially with minimum activity, cold hands, cold feet, and sometimes even hair loss. And here's what makes this tricky. Iron deficiency anemia isn't a disease on its own. It's a signal that something underneath is causing the iron to drop. If you just take iron supplements without figuring out why it's happening, it's like putting air in a tire with a nail still in it. You might feel better for a bit, but the problem will come back. You and your healthcare provider need to figure out why your iron is low. There's several ways people can become iron deficient. I like to remember them with the simple acronym LIFE, L-I-F-E. L stands for loss of blood. I, insufficient intake. F, failure of absorption. E, elevated demand or chronic inflammation. Let's break this down. 1, loss of blood. This is the most common cause. Think of iron like money in a savings account. Every time you lose blood, you make a withdrawal. Over time, even small repeated withdrawals can leave your account empty. But blood loss isn't always obvious. Some people lose blood slowly and silently from their GI tract. This can be caused by stomach ulcers, colonic polyps, inflammatory conditions, or even cancers. Number 2, insufficient intake. Iron comes in 2 forms. Heme iron, found in meat, poultry, fish, which is absorbed easily, and non-heme iron, found in plant foods, leafy greens, and fortified cereals, which is absorbed less efficiently. People with limited diets or low access to iron-rich foods are at high risk. Even vegetarians and vegans can meet their iron needs, but it takes intentional planning. Number 3, failure of absorption. This is when you are eating enough iron, but your body can't absorb it properly. Iron is absorbed mostly in the duodenum, the upper part of your small intestine. And if that area is damaged, bypassed, or inflamed, absorption can drop dramatically. This happens in conditions like celiac disease, inflammatory bowel disease, or after gastric bypass surgery. Even something as common as long-term use of acid-suppressing medications can reduce iron absorption because stomach acid helps the body take up iron. Examples of these medications are omeprazole and toprazole, commonly referred to as protein pump inhibitors. Number 4, elevated demand. Sometimes your iron levels drop not because of loss or poor absorption, but because your body needs more iron than usual. This can happen during pregnancy, athletes push their bodies hard, or in people recovering from surgery, illness, or trauma. When there's chronic inflammation, as in chronic kidney disease, rheumatoid arthritis, or long-term infections or cancer, the body increases a hormone called hepcidin, basically acts like a guard, locking up iron so it can't be used. That's why iron deficiency isn't just solved by popping a pill. Sometimes the real key is treat the underlying inflammation, treat the underlying disease. So now you understand why iron deficiency matters, what it is, and how it happens. The next step is what to do now. Here are practical, actionable steps anyone gets started with. Number 1, get tested. If you've been tired for weeks or months and can't explain it, ask your doctor about testing for iron deficiency. A basic blood test can reveal a lot. Sometimes the clues are in your daily life. Are your periods heavy or changing? Do you have GI symptoms like abdominal pain, black stools, bloating, or even heartburn? Are you on long-term medications such as NSAIDs or acid suppression? Are you recovering from a long illness? These clues help your doctor find the root cause quickly. Number 3, make smart nutritional moves. Even if you need medical treatment, nutrition is a great support. Add iron-rich foods like lean meats and chicken, fish, beans, lentils, tofu, spinach, and fortified cereals. Pair iron-rich foods with something high in vitamin C, like citrus fruits or bell peppers, or tomatoes to boost absorption. And try not to take iron with coffee or tea, which can block absorption. This isn't about changing your entire diet overnight. It's about making 1 or 2 small, smart adjustments that support your body. And number 4, treat the cause, not just the number. If iron is low, the real question is why? Why is this happening? Maybe it's heavy bleeding, ulcer, poor absorption, or something else. Addressing the root cause prevents the problem from coming back again and again. And number 5, very important follow-up. Iron deficiency can take weeks to months to fully correct. Following up on ensures your iron stores are truly replenished and not just temporarily boosted. Iron deficiency anemia is fixable, and the earlier it's caught, the easier it is to treat. And if this video helped you understand iron deficiency better, I'd love to hear from you. So give it a like, share it, subscribe to the channel, and if you want to see more videos, click right here, click right here. Have a good day and think your health.